Peds Patrol here, and there's a surge of human metapneumovirus. Here is what you need to know. So human metapneumovirus, or HMPV, is a winter virus illness. It does typically affect any age, but children are at higher risk, specifically less than 6 years of age. Similar to RSV, similar to influenza, it's a viral illness that can cause things like cough, runny nose, fever, as well as ear infections, nausea, vomiting. In younger children, it can also cause difficulty breathing as well as dry diapers. Here's an x-ray of an infant with human metapneumovirus, and as you can see, there's a lot of puffiness in both of the lung fields. Here's a CT scan also showing some infection as well in both of the lungs. So to diagnose it, you do need a nose swab. Interestingly enough, it is a viral infection, so there is no role for antibiotics. That being said, when you see x-rays like those, your doctor may actually prescribe you antibiotics, whether they're oral antibiotics or if you need inpatient, IV antibiotics. And it's not necessarily to actually treat the HMPV, but your doctor cannot rule out bacterial pneumonia or superinfection. So until the swab comes back, you may be on antibiotics, but once they isolate the source and it's known to be HMPV, your doctor will likely stop the antibiotics because treatment is really supportive care. Things like pain medicine, hydration, oxygen, and just time and rest. That being said, what are ways that we can prevent from contracting HMPV? Just like RSV and just like influenza, it's thinking about hand hygiene, whether that's with soap and water or hand sanitizer. Rather than using your hand to cover your mouth or your nose when you sneeze or cough, use your elbow instead. That way you can reduce the spread and touching anybody that may get infected. Of course, wearing a mask is always a good idea, especially if you're in crowded spaces or going to a party or going to a hangout. As always, if you feel like you have prolonged fever, not getting any better with any pain medicine, difficulty breathing, or having a hard time coping, you may want to consider going to the hospital or calling 911 to seek medical attention. And for all the parents and kids out there having HMPV or any other respiratory illness, you may need to take them out of daycare or school and help them heal at home.